Helping communities to face the future with confidence is a key factor in helping them to recover holistically. Let's now go to Galle, where thanks to the efforts of multiple stakeholders in the recovery process, their local medical facilities are being upgraded, and students are being taught important life-saving skills that would be useful in the case of an emergency.
The students of Ripon Girls' School in Galle are about to take a different sort of class today. Something that is not related to their usual subjects, like physics, chemistry or biology. But the children are about to learn something that is equally, if not more important. This is a lesson in life-saving skills and techniques that could help them in any emergency situation. Over 2 years ago, the 2004 Asian tsunami wreaked havoc along Sri Lanka's coastal regions, and the Galle district was no exception. In the prevailing chaos and confusion, few were aware of how to effectively help the injured or handle the situation.
Very often, people don't know what to do in an emergency situation. The tsunami was a good example. So creating awareness among children is a good place to start. That's why we are trying to educate school children. We hope that this information will reach the rest of the community through the children and benefit society.
To improve things and ensure that local residents are more aware of basic life-saving techniques, the Galle Medical Association, the Karapitia Hospital Development Society and USAID conducted a training program for senior students of 50 schools in the district. The program included training on CPR, basic life support and first aid that would facilitate a more professional response during emergencies.
We had never been taught something like this before. With the knowledge that we gain today, we will be able to save a person's life in the future.
It is best that we are aware of the first aid procedure in case of an emergency at home.
The program has been able to do more than just create individuals with awareness of basic life-saving skills. It has also contributed towards strengthening bonds between the medical community and the general public, helping to improve credibility and accountability.
It is a doctor that we go to for treatment when we are sick, and if there is a strong relationship, the doctor will be able to give the patient more advice and assistance. They will be motivated to be of service to society by ensuring good health standards.
This initiative has given a segment of Sri Lanka's youth better access to vital health information. It is part of a larger project under the banner of Health for the South that emerged through the partnership of many more stakeholders and addresses several issues. As a result of the assistance that was mobilized after the tsunami, the Karapitia Teaching Hospital has been able to improve and upgrade several facilities and services. With the support of the Victorian Government of Australia, the Karapitia Hospital will soon have an accident and emergency unit. The success of the project, which costs around 500 million rupees, has been attributed to the good partnership that emerged among the Sri Lankan government, the Victorian government, USAID and a corporate institution, the Selinco Group of companies.
On our behalf, in fact, the Victorian government were looking for other donors to equip the accident and emergency unit, and USAID, I'm very grateful to them. Then they came in and they agreed to equip the emergency treatment unit of the accident and emergency unit.
The Karapitia Hospital in Galle is a primary provider of health services to the southern province of Sri Lanka, extending its facilities and services to several outlying hospitals in the region. The upgraded hospital will also benefit medical students at the Runa University.
It is going to enhance the quality of teaching because they can carry out treatment methods which are found in developed world which we may not have been able to optimally carry out in the past due to lack of certain equipment and working space.
Like elsewhere along the coast in the Galle district too, the tsunami recovery process made it possible to take a holistic approach to the development needs of the area. As a result, projects like Health for the South will have a long-term impact and contribute towards a better healthcare sector in the country.